Diagnostic laparoscopy. An overview. Diagnostic laparoscopy is a minimally invasive surgical procedure that allows doctors to examine the organs inside the abdomen and pelvis. This technique involves making small incisions in the abdominal wall through which a laparoscope, a thin tube with a camera and light, is inserted to provide high-definition images of the internal organs. Laparoscopy is commonly used for diagnostic purposes, but can also serve as a therapeutic tool for treating certain conditions during the same procedure. This technique has revolutionized diagnostic and therapeutic abdominal surgery due to its effectiveness, safety, and minimal recovery time. Purpose and indications. The primary purpose of diagnostic laparoscopy is to identify the underlying cause of unexplained abdominal or pelvic symptoms. It is especially useful when non-invasive imaging techniques such as ultrasound, CT scans, or MRIs fail to provide clear answers. The procedure allows doctors to directly visualize organs, take biopsies, or even perform minor surgical interventions if needed. Some of the key indications for diagnostic laparoscopy include chronic abdominal pain. When patients suffer from unexplained chronic abdominal pain that does not resolve with conventional treatments, laparoscopy can help identify conditions such as endometriosis, adhesions, or inflammatory bowel disease. 2. Abnormal imaging results. If previous imaging tests such as CT or MRI scans show abnormal findings but lack specificity, laparoscopy may provide the necessary clarity to diagnose the issue. 3. Cancer diagnosis and staging. In cases of suspected abdominal or pelvic cancer, diagnostic laparoscopy can assist in staging the disease and determining the extent of metastasis, especially in cancers like liver, gastric, or ovarian cancer. 4. Infections and inflammatory conditions. Laparoscopy can help detect abscesses, peritonitis, or other infections within the abdominal cavity. 5. Pelvic and abdominal tuberculosis. When tuberculosis is suspected in the abdomen or pelvis, laparoscopy is an effective way to confirm the diagnosis. 6. Ectopic pregnancy. In cases of suspected ectopic pregnancy with uncertain diagnosis from non-invasive methods, laparoscopy can confirm the presence of an ectopic gestation. 7. Evaluation of the female reproductive organs. In women, diagnostic laparoscopy is a common procedure used to evaluate conditions such as endometriosis, pelvic inflammatory disease, PID, fibroids, and ovarian cysts. Procedure. The procedure is typically done under general anesthesia and can last anywhere from 30 minutes to 2 hours, depending on the complexity of the condition being diagnosed. Here are the general steps of diagnostic laparoscopy. 1. Preparation. Before the procedure, patients are given instructions on how to prepare, which may include fasting for several hours prior to surgery. In some cases, bowel preparation may be needed. 2. Incisions and access. After anesthesia is administered, the surgeon makes one or more small incisions, usually between 0.5 to 1 centimeters, near the belly button or other areas of the abdomen. A trocar, a sharp instrument, is inserted through these incisions to create access for the laparoscope. 3. Inserting the laparoscope. The laparoscope, which is a thin tube with a light and camera at the end, is inserted into the abdominal cavity. The camera transmits real-time images to a monitor, allowing the surgeon to visualize the internal organs. 4. Exploration and diagnosis. The surgeon systematically inspects the organs in the abdominal and pelvic cavities, looking for any abnormalities such as tumors, inflammation, or signs of infection. In some cases, the surgeon may also perform additional diagnostic steps, such as taking biopsy samples, draining cysts, or releasing adhesions. 5. Closure. Once the diagnostic examination is complete, the laparoscope is removed, and the small incisions are closed with sutures or surgical tape. The entire procedure is minimally invasive, resulting in less pain and a faster recovery time compared to traditional open surgery. Advantages. Diagnostic laparoscopy offers several advantages over traditional open surgery or other imaging techniques. Minimally invasive. The small incisions used in laparoscopy cause less trauma to the body, reducing pain and scarring. Faster recovery. Patients can often return to normal activities much sooner than they would after traditional open surgery. Hospital stays are typically shorter, and many patients can go home on the same day. Accurate diagnosis. The ability to directly visualize the organs in real time ensures a more accurate diagnosis than other imaging methods. Therapeutic potential. If a problem is discovered, such as an adhesion or cyst, the surgeon can often treat it during the same procedure, avoiding the need for separate surgeries. Lower risk of infection. Since the incisions are smaller and less invasive, the risk of infection is lower compared to open surgery. Risks and complications. Though diagnostic laparoscopy is considered safe, it is still a surgical procedure with some potential risks. Infection. As with any surgery, there is a risk of infection at the incision sites. Bleeding. Some bleeding may occur, particularly if the surgeon needs to biopsy or manipulate organs. Injury to organs. There is a small risk of damaging internal organs such as the bladder, bowel, or blood vessels during the procedure. Gas embolism, a rare but serious complication where air from the insufflation of gas into the abdomen can enter the bloodstream, causing a blockage. Postoperative pain. Some patients may experience discomfort or pain after the procedure, though it is usually minimal and short-lived. Conclusion. Diagnostic laparoscopy is an invaluable tool in modern medicine, providing a minimally invasive, highly effective method for diagnosing and sometimes treating a wide range of abdominal and pelvic conditions. It has transformed the way many conditions are diagnosed, enabling quicker and more accurate identification of diseases that were once difficult to detect. The reduced risk, faster recovery time, and potential for immediate treatment make laparoscopy a preferred approach in many clinical settings. However, like all surgical procedures, it carries some risks, and careful consideration must be given to each patient's condition before opting for this technique.